I, Dr. Seema Tandon, on behalf of RRTC team, welcome Dr. Nasreen and all the participants for joining the session on use of partograph. Dr. Nasreen, we know that this topic on use of partograph is very important to identify prolonged labor and obstructed labor, which is a very important cause of maternal death. So thank you so much, Nasreen, for taking out time for this session. And I welcome you once again. Over to you, Nasreen.
Now we are proceeding with the session of partograph. Partograph is a tool or it is a graphical recording of three components. Just remember, progress of labor, maternal condition and fetal condition. Next. Okay, now here again you are having a question there. The stages of labor की बात हुई थी. First stage का क्या duration? Again both are different. Multi में अलग है, primary में अलग है. So stage 1 12 hours है, multi में 6 to 8 hours है. This was the question in your questionnaire. And stage 2 जो है ना, that is 2 hours in primary and generally 1 hour. Stage 3 is 15 to 30 minutes, both in primary and multi. So normally once we are giving active management oxytocin, so this is around 15 minutes in both multi and primary. Okay, you have got one questionnaire. Stage 1 primary में कितना होती है, multi में कितना होती है. So just remember primary में 12 hours है and multi में it is 6 to 8 hours. Second stage simple to remember. Second stage 2 for 2, 2 घंटा primary में, उसका half कर दीजिए multi में, और 15 minutes to 30 minutes in both. Next. So when you are having this graphical paper, that is a partograph. So topmost part of this partograph contains the personal detail of the patient or the general information, starting the name of the patient, which PHC, any PHC number, registration number, date of time of admission. If the membranes are ruptured, they also say you have to display rupture. Then just below that you have to give the fetal condition, fetal heart rate है, color of liquor है. उसके नीचे जब आप आएंगे, that portion एक portion है, that is cervical dilatation with respect to time. उसमें हम cervical dilatation note करते हैं. In respect to time, you are also plotting the descent of fetal head. And bottom पे there are maternal conditions. और जहाँ cervical dilatation हम plot करते हैं, उसके नीचे you have to write down the contractions in 10 minutes, any drugs given during labor. And below, the bottom of the partograph shows the maternal conditions, pulse, BP, temperature, urinary output. So this is all a single graph paper, which is providing you the three types of information. You can see what is the progress of labor. You can assess the maternal condition during labor and fetal condition during labor. Just at a glance, you can take immediate intervention if required. Next. Again, we talk about latent phase. Latent phase, no partograph. Just remember, latent phase में हमें partograph नहीं बनाना है. So we have to plot the partograph in active phase. But what you can do, you can just, when the patient, you have received the patient, now she is 2 centimeter dilated. You are not supposed to draw a partograph, what we say, latent phase में नहीं बनाना है. But at least you can document in your case sheet. When the patient has reported to you, if she is 1 centimeter, 2 centimeter dilated, you have to note down in your case sheet. So at least you can assess, मान लो 12 घंटे तक नहीं, 20 घंटे तक she is not able to deliver, she is in the same status. So you have to see whether she is having a prolonged latent phase or not. More than 20 hours latent phase नहीं होना चाहिए. If it is crossing more than 20 hours, it is a prolonged latent phase. Normally 8 to 18 hours होता है. अगर 20 घंटे से ज़्यादा हो रहा है, तो हमारा latent phase prolonged हो गया. ओके, तो एक हम आज की ये बात हमें है कि हमें latent phase में partograph नहीं बनाना है. We have to plot the partograph only when the patient is 4 centimeter or more than 4 centimeter. It means that she is in an active phase. एक हमारे पार्टोग्राफ पे अभी क्वेश्चनर में था क्या क्या चीजें हम एक घंटे पे हम प्लॉट करेंगे. सो अगेन द आंसर लाइज हियर. एवरी आवर यू हैव टू plot, or every half hour or 1 hour you have to plot the fetal heart rate. अब पार्टोग्राफ पे हमें प्लॉट करना है तो हमें हर 1 घंटे पे प्लॉट करना है, और every 4 hours because you have to assess the patient by doing the per-vaginal examination, and you have to also see the general condition of the mother, whether the mother is running fever or maternal tachycardia तो नहीं है, maternal dehydration तो नहीं है. So maternal vitals are important, and by PV you have to assess the status of the cervical dilatation. When you are doing the PV examination, cervical dilatation, holding, or if the membranes are ruptured, you have to see the color of liquor also. But remember, whenever your patient is in a labor, don't leave the patient alone. That is very important. Okay. Next. Now the active phase, now it's time to plot a partograph. And in the partograph, there are certain things that has to be recorded half hourly. In half hourly, you have to plot the fetal heart rate. Ideally, we are also plotting the fetal heart rate hourly or half hourly. Maternal pulse, again the status of the amniotic fluid and membrane, they have to be recorded. If the liquor is clear, then you have to record. If the liquor is meconium stain, then you have to record. And there are certain standard marks for that. If the membranes are intact, you have to put I, capital I. If the liquor is clear, capital C. This will, if anybody will see the partograph, yes. Okay. So number of contractions, you have to assess every 10 minutes how many contractions she is having, or every 4 hours you have to assess the maternal pulse, cervical dilatation, whether there is any element of molding, fetal disease. This has to be plotted every 4 hourly. Again, this questionnaire was there in your question when we discussed the pre-test. Again, what are the things that has to be plotted 4 hourly? What are the things that has to be plotted half hourly or 1 hourly? That was again in a questionnaire. Okay, next. Now this is a partograph. Is it visible for all of you? Is it visible over there, partograph?
Yes, ma'am.
Okay, once you go to the topmost, what just now theoretically we have discussed, now you can see the first arrow give the entire detail of the patient, including the name of the patient, patient age, identification, any registration number, name of the PHC, membranes rupture, what is the time of admission. So first arrow will give the general information, topmost of the partograph. Now the second arrow, you can see graph A, that will give you the fetal condition. So fetal tachycardia, agar more than 160, fetal bradycardia, if it is less than 110. Okay. So और उसमें fetal condition में हमने fetal heart देखा. Then again fetal heart rate we have seen. We also want to assess the color of liquor if membranes ruptured. So you have to also write the status of the membrane, whether the membranes are intact or ruptured. If they are intact, then you have to write with the symbol I. That means the membranes are intact. If they are ruptured, you have to put the symbol R. Then if the membranes are ruptured, you have to see the color of the liquor. If it is clear, mark with C. If it is meconium stain, mark with M. If it is blood stain, mark with B. So this goes with the second arrow, that is a graph A. Then the third part is most important of this partograph. It is most crucial. It is also known as a cervicograph, because we are plotting cervical dilatation with respect to the time. So sometimes somebody will ask you what is cervicograph. So it is nothing. It is one component or one part of a partograph, which you can see as a third arrow, graph B, where you are plotting cervical dilatation with respect to time. And here you are also plotting the cervical descent. Here in this part, this is used for the progress of labor. And how we assess the progress of labor? Again, there was a questionnaire. We have to see cervical dilatation and descent of the fetal head. And in this portion, you can see what two lines are there. One is alert line and another is action line. Alert line is, it starts from 4 centimeter, and because the rate of dilatation is 1 centimeter per hour, so we plot this line. And 4 hours to the right of this line is another line that is known as an action line. if any partograph is coming beyond action line, you have to intervene. If any partograph is crossing the alert line, it means that she is going into prolonged labor. So you have to reevaluate your patient, very important. So this, if it is filled properly, timely action can be taken. And if you are referring any pregnant lady with a properly filled partograph, so the person sitting at a distance with this sheet of paper get lot of information. They will get all the information regarding the progress of labor, maternal condition, fetal condition. Just plain sheet of paper. Now coming to the bottom of this partograph, which shows graph D, last arrow, and it is for the maternal condition, in which you have to plot maternal parameters, in which maternal parameters means maternal vitals like maternal pulse, maternal blood pressure, maternal temperature, and urine output. And when we are talking about the progress of labor, graph B and graph, just below the graph B, there is another graph C, where you have to write contraction that is occurring in 10 minutes. And below that, you have to write all the medication that has been given to the mother when she is in labor. So we have already discussed. Later on, we will have some practice, participant practice. And again, they are just telling the same thing. It is an fetal heart condition, maternal pulse, where you are supposed to record all the parameters. So just remember topmost part, all the maternal identification data. Then below that, fetal condition, in which you record the fetal heart, color of LICA, membrane, status of the membranes. And below that, you are having a cervical for the progress cervicograph. That is the progress of labor, cervical dilatation in respect to time, cervical descent. Below that, there is a column for record of the uterine contraction in 10 minutes, whatever the drugs mother is receiving. And the bottom part shows the maternal vitals, pulse, BP, temperature, and urinary outputs. Sometimes some parthographs also give the detailed information of urine in form of whether there is ketone in the urine or albumins or protein. So that is the bottom part. Okay, next. We have already discussed with this thing, fetal conditions. So how to mark this? So we have discussed regarding the status of the membrane and the color of LICA, how to donate. Now there is also we have to donate regarding the molding. So molding, small amount of molding is beneficial because it helps the fetus to go through the very normal vaginal passage. But if it is excessive molding, then it can be dangerous, and it is one of the signs of obstructed labor. So there are 3 grades of molding. Grade 1, when the suture line, they are just touching each other. Grade 2, the suture lines overlap, but it can be separated. And grade 3, suture line is overlapped, and we are not able to separate that. That is excessive molding. And it is grade 3 molding is one of the important sign of obstructed labor. So again, when we are plotting on a partograph, you have to show molding by +1, +2, +3. So this is about the molding. Next. So again, this is just an exercise for you all. Fetal heart rate, fetal conditions. So if the fetal, what does it, how to interfere fetal heart rate on this partograph? Kitna hai fetal, what does this dot donate? So at any point of time, you have to donate fetal heart, और उसको हम एक dot से हमने दिखा दिया. At that particular time, so at the start of this partograph, you can see there is one dot. So what is the fetal heart rate at that time? जो पहला डॉट है तो fetal heart rate कितना है? 120 per minute है. और what is the status of amniotic fluid at that particular time? What is the status of the membrane?
Membrane है
Intact.
intact.
So I stand for
Intact membrane.
okay. So membranes are there; they are not ruptured. That is why they have put I, membranes intact. So that is why we are not writing the color of LICA. क्योंकि membranes intact है, so there is no need to write the color of LICA. And what about molding? It is 0 means there is no overlap. 0 molding means the sutures are there, they are distant apart, and there is no element of molding. Okay, what does M mean here?
Meconium.
Meconium.
M is 10. +2 means second degree
Molding
molding.
+2.
+2 molding, second degree molding. So how do you define second degree molding? +2 molding का what do you mean? What do you
मैम
understand?
बोन ओवरलैप करेंगी, प्रेशर से हट जाएंगी.
Okay, sutures they are overlap but it can be separate. You can separate them. Okay. तो ये जो है ना सारा आपका ये किस तरह से डिपिक्ट करना है और उन्होंने डायग्रामेटिक नीचे दिखाया भी है. ग्रेड 1 मोल्डिंग जस्ट सूचर लाइन जस्ट टचिंग. 0 को और फर्स्ट को जब आप कंपेयर करेंगे तो 0 में सूचर्स अपार्ट हैं. देयर इज नो एलिमेंट ऑफ मोल्डिंग. इन ग्रेड 1 यू कैन सी दे आर सूचर्स, दे आर कमिंग, दे आर जस्ट अप्रोक्सीमेटेड, तो दे आर नियर बाय. तो ग्रेड 1 हो गया. ग्रेड 2 में दे आर जस्ट slightly overlapping but can be separated, and 3 में they are overlapped but not separated. So we are worried when we are having grade 3 molding, which is not good and it can be a sign of obstetric labor. So we have to reevaluate कि क्या reason है जिसमें grade 3 molding आ रही है, या pelvis छोटी है या बच्चा बड़ा है, there is element of CPD, या there is some problem with the obstetric labor why this patient is going into obstetric labor with excessive molding. Next. Now we have to ascend. We have to also see the for the progress of labor क्या क्या चीजें देखना है हमको. We have to see the cervical dilatation and we have to see the descent of fetal head. Again there was a questionnaire कि हमें progress of labor के लिए क्या क्या देखना है. तो हमें dilatation देखना है, उसके साथ साथ हमें effacement, dilatation and descent of the fetal head is also important. So dilatation, full dilatation is around 10 centimeters. So this is a diameter. They have given the dilatation. हमें dilatation जब पीवी करना है, डायलेटेशन देखना है और उसको हमें पार्टोग्राफ पे प्लॉट करना है और साथ में हमें डिसेंट भी देखना है. तो डिसेंट हम पर एब्डोमेन भी देख सकते हैं और हम पीवी से भी देख सकते हैं. तो जो इश्चियल स्पाइन का लेवल होता है बाई स्पाइनस डायमीटर फीटल पेल्विस पे, जब बाई स्पाइनस डायमीटर होता है दिस इज अराउंड 10 सेंटीमीटर. सो व्हेन वी असेस द pelvis we put our hand inside and we try to stretch. If we are able to stretch and we are not able to touch the ischial spine, it means it is 10 centimeter dilated. और normally roughly कहते हैं कि जो ladies जब fingers होती हैं on an average जैसे one finger is equivalent to 1.5 centimeter. Unless and until if anybody is having a lady's finger बहुत पतली हैं तो उनका 1 centimeter होगा. Otherwise roughly we take on an average 1.5 centimeter one finger. तो अगर किसी का हमने PV करा और हम we are able to put 2 finger, it means how much is the dilatation?
3 centimeter.
3 centimeter on an average. तो इस तरह से हम उसका डायलिटेशन असेस कर लेंगे. और डिसेंट के लिए हमने ये देखा है कि जो इश्चियल स्पाइन्स होते हैं वो लेवल को हम मानते हैं 0. अगर हमें परवे चैनल करना है दैट लेवल इज करस्पॉन्डिंग टू 0 स्टेशन. उससे 1 सेंटीमीटर ऊपर जाएंगे तो दैट इज -1, फिर और ऊपर जाएंगे दैट इज -2, और जब ब्रिम पे होगा जो इश्चियल स्पाइन जब पेल्विक ब्रिम पे ऊपर होता है दैट इज -3. सिमिलरली वी गोज डाउन 0 स्टेशन से जब हम 1 सेंटीमीटर नीचे आएंगे इश्चियल स्पाइन से तो दैट इज +1, फिर 1 सेंटीमीटर +2, और पूरा पेरिनियम के बाहर जब पेरिनियम के बल्ज करेगा हेड बिल्कुल पेरिनियम पे आ गया है दैट इज मोर देन +2 +3 ले लेते हैं. तो दिस इज अबाउट द descent. Okay, next. So we talked about all these line के कहाँ पे क्या प्लॉट करना है. बस ये याद रखना है आपको कि जो फर्स्ट रीडिंग होती है that has to be plotted on alert line. फर्स्ट रीडिंग हमें अलर्ट लाइन पे ही ड्रॉ करनी है और वहीं से हमें टाइम करना है, उसके करस्पॉन्डिंग ही हमें टाइम करना है. और इसको हम दिखाते हैं किससे दिखाते हैं, इसको एक क्रॉस से दिखाते हैं और सर्वाइकल डिसेंट को हम एक सर्किल विद अ डॉट दिखाते हैं. नेक्स्ट. सो इन दिस पार्टोग्राफ इफ यू सी अ क्रॉस एट द स्टार्ट, तो पहले स्टार्ट पे जो है वो 4 सेंटीमीटर पे एक क्रॉस बना हुआ है और फर्स्ट रीडिंग वी हैव प्लॉटेड ऑन द अलर्ट लाइन. तो हमारा यू सी द ग्राफ एज द रीडिंग गोज ऑन, तो ग्राफ बिल्कुल करस्पॉन्ड कर रहा है। और डिसेंड, हम फीटल डिसेंड को हम दिखाते हैं विद अ सर्किल एंड अ डॉट। सो डिसेंड, और ये 5th होता है 5/5 जब पेल्विक ब्रिम पे है, ठीक है, 0/5 जब वो नीचे आ गया पेरिनियम पे। तो ये हमने दिखाया 5/5 जब ब्रिम के ऊपर है, फिर हेड जो नीचे डिसेंड होता है 4/5 हुआ, 3/5 हुआ, इश्चियल स्पाइन के लेवल पे 2/5 to 1/5 होता है, और डिलीवरी पे इट इज अराउंड 0/, पेरिनियम पे 0/5। बस remember, just previous slide please. Okay, so whenever you have to see, whenever your plotted partograph is deviating from the alert line, so if plotting is to the right side of the alert line and towards the action line, it shows poor progress of labor and it is time to take action. Either you have to refer that patient because it is not a normal. So any partograph which is deviating and moving toward the right side of an alert line, then it is a sign to take a, it is a sign whether this labor is not progressing properly, or it is an abnormal progress, or it is a poor progress of labor. So whenever just partograph should be on the left of the alert line, or it should correspond to the alert line. Okay, next. So again they emphasize, if the plotting of the cervical dilatation is to the right of the line A, either the labor is prolonged, or it is obstructed, or you need continuous observation, or you refer the patient to higher center for cesarean section. So re-evaluation is very important because it is deviating from the normal. So the partograph should be either on the alert line or to the left. If it is moving to the right side, re-evaluation, and if it requires referral, or your patient is going into prolonged labor or obstructed labor. Maybe initially you have not assessed the pelvis, and as she moves with the labor, now there is an element of CPD, cephalopelvic disproportion, and because of the short CPD, she is not progressing, or she is going into the prolonged labor or obstructed labor. So that is very important, re-evaluation, and if required, referral. Okay, next. So again, how to plot the contractions, that is again important. So contractions and maternal condition. So ideally 10 minutes mein there should be 3 contractions lasting for more than 40 to 45 seconds. So again, depending upon the intensity of the contractions, maybe the patient is having 3 contractions, lekin uski intensity less than 20 seconds hai, so we have to plot with the dot. If the contractions, she is having a 3 contractions but the intensity is again more than 20 to 40 के बीच में lie कर रही है, so we have to plot with the line. Or if she is having 3 contraction, as you say, more than 45 seconds के हैं, so we have to just fill the box. We have to color it. बिल्कुल बोल्ड से हमको उसको भर देना है पूरा. तो अगर आपको कोई पार्टोग्राफ में ऐसा दिख रहा है कि 3 बॉक्स भरे हुए हैं बिल्कुल डार्क कलर से, it means that your patient is having good uterine contractions, that is a contractions more than 40 seconds. So what ideally we want during 10 minutes time there should be ideally 3 contractions of more than 40 seconds. तो अगर 40 seconds में इसमें हम देखेंगे, once you are seeing, so ideally what is happening, फर्स्ट में डॉटेड से इसका मतलब 3 कॉन्ट्रैक्शंस आ रहे हैं जिसका लेस देन 20 सेकंड इंटेंसिटी है. सेकंड बॉक्स में हमने देखा लाइन से बना हुआ है, देयर आर 4 कॉन्ट्रैक्शंस इन 10 मिनट्स बिकॉज वी आर प्लॉटिंग इन 10 मिनट्स ओनली. So there are 4 contractions in 10 minutes. So we are drawing with the line. And in third box you can see bold से बिल्कुल colored करा हुआ है और 4 कलर करे हुए हैं. इसका मतलब 4 contractions हैं जो कि 10 minutes में आ रहे हैं and more than 40 seconds. So this is how we are marking contractions on a partograph. और उसके नीचे आपने देखा there is how much oxytocin is given. So normally oxytocin we are giving in 500 ml of fluid. So they are writing the amount of fluid. Normally हम 500 NS में डालते हैं और कितना उसमें आपने डाला है, 2.5 डाला है. So they are mentioning the strength, how much oxytocin is given, dose of the oxytocin, in which fluid, how many fluid, in what amount of fluid it is given, and what is the drop rate. It is also very important. So you have to mention where you are plotting the contraction. कोई ऐसा तो नहीं है कि बहुत ज़्यादा हमने ऑक्सीटोसिन दे दिया है, उसका डोज ज़्यादा चला गया है या स्ट्रेंथ ज़्यादा है, दैट इज व्हाई द पेशेंट इज हैविंग अ हाइपर स्टिमुलेशन, बहुत ज़्यादा उसको कंट्रैक्शंस आ रहे हैं. So that is why the dose of the oxytocin along with the strength should also be write down. You have to also mention on a partograph just below the contraction. Next. Now, bottom part, again the maternal condition. You said one of the component of partograph is plotting the maternal conditions. And maternal conditions, we are plotting the maternal vitals in form of pulse, BP, temperature, whatsoever drugs given during to the mother during labor, and what about the urinary output. And in the urinary output, you can also have a basic evaluation in form of whether there is protein in the urine, whether there is sugar or acetone. You have to mention it out. So you have to record if there is a pulse is 80, you have to put a dot. If the BP is 100 by, so you have to show the BP with an arrow, one arrow towards the systolic and another arrow towards the diastolic, and you have to join that arrow. This signifies that the patient is having BP 140, 90 or whatsoever. So it is giving systolic and diastolic BP, maternal pulse. So at a glance, you can see whether the pulse is rising or it is falling. Maternal tachycardia is there, maternal bradycardia is there. What is the status of the BP? So you can find, and you have to also record the temperature. Next. So in the urinary column, they said there is no protein, no acetone, and volume is normal. So you have to mention it out. Next. So again, so if you go a long time back, there is a simple partograph. Friedman, he discovered partograph, and that partograph is also taking into account the latent phase, active phase. But this is different. In this partograph, we are also considering the molding, dose of the drug given, descent of the fetal head. So this is a newer component, and it is different from the simplified one. Previously, what we are using to plot. Okay. Next. So ultimately, I want to ask from any of the participant, whenever you are receiving any patient in latent phase, what all practicing you are doing. कोई patient आई 3 centimeter dilated है, she is having pain. So what are the do's and what are don'ts? तो हमें क्या क्या करना चाहिए? So any participant can read the do's during labor. क्या क्या do's हैं during labor जो हमें करना है और उसकी हमें मास्टरी भी करनी है कि हमें करना है. Okay, who is going to read? Varsha is there?
Yes, ma'am.
Yes, Varsha, do me a favor. Do's क्या क्या है लेबर में, बेटा पढ़ो उसको.
अच्छा. Have someone to be with the mother.
ये हमने बात करी थी, कोई भी पेशेंट लेबर में होगी, डोंट लीव योर पेशेंट अलोन. सो यू हैव टू अलाउ अ बर्थ कंपेनियन. कोई भी हो सकता है, लेकिन मरीज को अकेला नहीं छोड़ना है. ठीक. नेक्स्ट.
Encourage the mother to empty her bladder.
मदर से कह सकते हैं यूरिन पास करो, बैठ के करो, वॉशरूम में जाना चाह रही है तो करे. हमें उसको कैथेटराइज नहीं करना है, बेड पेन नहीं लगाना है. So patient is comfortable, you have to encourage. ठीक है, बाथरूम आ रहा है, you can go to the washroom, you can sit, pass urine. Unnecessary catheterization नहीं कराना है, unnecessary bed pen नहीं लगाना है. Okay.
Ensure adequate fluid intake, light diet.
Okay. आपको जो है ना लेबर में स्ट्रेसफुल कंडीशन है, पेशेंट को अच्छे से रिहाइड्रेट करना है, तो ओरल लिक्विड ले सकती है. ओरल सिप्स शी कैन हैव. हेवी डाइट नहीं देना है क्योंकि एनी टाइम शी कैन लैंड अप इनटू सिजेरियन. तो लाइट डाइट शी कैन हैव. नील ओरली ले लगना है कि पेशेंट आया उसको ड्रिप नहीं लगाना है कि पेशेंट आ गया अभी लेटेंट फेज में लेबर में, Unnecessary IV fluid नहीं देना है unless and until it is required. What else?
Encourage mother to maintain a comfortable position and walk if she wishes.
ठीक है, उसको बेड उठे नहीं करना है कि भाई लेबर में दर्द आ रहा है, आप उसको टेबल पे डाल दिया, लेबर टेबल पे पैर मोड़ दिया. She will be exhausted. So what you are supposed to do? She is comfortable. She can move around. She can walk around. She is in early labor. She can attain any posture. बैठ सकती है, लेट सकती है, थोड़ा मूव अराउंड कर सकती है.
Monitor intensively and using the partograph.
वो पार्टोग्राफ अगर एक एक्टिव फेज में आई है तो हमें उसका पार्टोग्राफ ड्रॉ करना है. If she is not in active phase, she is in latent phase when she has reported to us. So we have to document the findings.
Manage and refer immediately if any complication is detected and woman is not in impending labor.
अगर आपको लग रहा है कि she required patient है 9 months amenorrhea, she is having heavy bleeding, आप सस्पेक्ट करें कि APS तो नहीं है, प्लेसेंटा तो नहीं है, इंडिकेटर है तो आप उसको, या आपको कुछ अलार्मिंग प्रीवियस सेक्शन स्कार टेंडरनेस लग रही है तो आपको उसको अकॉर्डिंगली रेफर करना है. अगर कोई साइन आपको ऐसे एमिनेंट लग रहे हैं कि हमें इसको रेफर करना है, इम्पेंडिंग प्रॉब्लम हो रही है कुछ, तो अल्टीमेटली यू हैव टू टाइमली रेफरल इज वेरी इंपॉर्टेंट. आपने कुछ कॉम्प्लिकेशन कर दिया देन यू आर रेफरिंग, तो दैट इज नॉट गुड. तो अगर हमें रेफर भी करना है तो टाइमली इंटरवीन करना है. इफ वी आर सस्पेक्टिंग एनीथिंग, इफ द मदर इज इन डेंजर और वी आर सस्पेक्टिंग हम नहीं मैनेज कर पाएंगे, तो बेटर है टाइमली उसको हम रेफर.
मैम डोंट लेबर में आएगा कि डू नॉट स्टार्ट ए पार्टोग्राफ इन द लेटेंट फेज ऑफ द लेबर, जो आपने हमें पहले ही बताया सबसे पहले.
तो ये दिस इज अ मैसेज फॉर टुडे. आज हम रट लेंगे इन लेटेंट फेज में पार्टोग्राफ नहीं बनाना है, बट हमें अपनी केस शीट पे हम डॉक्यूमेंट.
डू नॉट यूज एन ऑक्सीटोसिन लाइक ऑक्सीटोसिन टू इंड्यूस और एक्सेलरेट लेबर as they are associated with a high incidence of rupture of the uterus.
ओके, अननेसेसरी नहीं देना है, हमें असेस करना है पेशेंट का. इफ शी डोंट रिक्वायर नॉट टू गिव. अननेसेसरी हमें हर चीज स्पॉन्टेनियस छोड़ना है, क्योंकि इफ वी गो बैक टू द नॉर्मल डेफिनेशन ऑफ लेबर इट शुड बी स्पॉन्टेनियस. सो व्हाई टू इंटरवीन अननेसेसरी? हमें अननेसेसरी कोई इंटरवेंशन नहीं करना है.
Yes, ma'am. Next है, do not give an enema routinely to a mother in labor. Do not delay in referring any complication. ये तो मैम बाद में, पहले तो हमें ये समझना है कि हमें एनिमा नहीं देना है रूटीनली मदर में
ओके
लेबर के टाइम.
ओके.
And do not delay in referring any complication identified if woman is not in impending labor. If cervical dilatation line has crossed A line or alert line, fetal heart rate is less than 120 or more than 160 per minute, or meconium stained liquor.
ओके. और लास्ट बट नॉट द लीस्ट, रिस्पेक्टफुल मैटरनिटी केयर के लिए ये है कि अगर हम रिस्पेक्टफुल मैटरनिटी केयर कर रहे हैं तो वी शुड ऑलवेज अलाउ अ बर्थ कंपेनियन. वी शुड नॉट लीव एनी प्रेग्नेंट लेडी or any mother who is in labor alone. You should allow a birth companion. So don't leave your patient alone. After having a partograph, this completes your partograph. If you want any question, so we can discuss. Otherwise, we can go on one case study. So you can plot a partograph. So switching over to the case study on partograph. If you are comfortable, otherwise we can discuss one case study, and you have to see how it is plotted. Okay, so this case study just there are patient particulars. Radha, wife of Gangaram, 26 years of age, third gravida, and admitted at 5 a.m. on 11th March with the complaint of full-term pregnancy with labor pains since 2 a.m. Her membranes ruptured at 4. She has 2 children of age 5 and 2 years. On admission, her cervix was 2 centimeter dilated. Starting, the cervix is 5 centimeter dilated. Now she's in active phase. She had 3 contractions in 10 minutes. These last 30 seconds. The fetal heart was 120. The membranes have ruptured. तो ये सारा सिनेरियो जो चीजें दी हुई हैं, तो हम पार्टोग्राफ पे आते हैं, हाउ इट इज प्लॉटेड. और क्योंकि बिकॉज फिर अगेन द पार्टोग्राफ हैज टू प्लॉटेड द सिनेरियो हैज बीन गिवन टू यू. कि 9:30 पे पेशेंट का ये हो गया, फिर फर्दर 10 बजे पेशेंट का ये कंडीशन हो गया. सो कमिंग टू द पार्टोग्राफ, let's show the filled partograph. So is it okay? The wife, this thing, Radha, wife of Gangaram. So patient के जो particulars है, they have filled on the topmost part that carries the general information. Then the fetal heart they are showing with the cross. 5 centimeter cervical dilatation, again on the alert line, because first reading has to be on the alert line. On that alert line will correspond to the time. जहाँ पे आपने 5 centimeter plot करा है, उसी के नीचे एक line draw कर लीजिए और वो आपका time होगा. वो आपका जिस time से आपने पार्टोग्राफ plot करा है वो time होगा. तो 5 centimeter पे 9 AM they have given the time, so you have plotted the 9 AM. Then below the number of contractions given, drugs given, and patient parameters. Now show the field partograph, complete field partograph. So with this partograph study, suppose I have plotted this partograph for you and I have referred this patient with this partograph. So what inference you can draw by just seeing this partograph? इससे क्या क्या information आपको पता चल रही है? Whether just by seeing this partograph, whether this labor is progressing normally or it is abnormal.
Then progress normally.
Why you are saying it is progress normal? Because the line which we have drawn for the cervical dilatation, it is towards the left of alert line. Alert line के right में नहीं आई है, or it is towards left, or it should correspond. So rightly said, the labor is progressing normally. So can you tell me what is the condition of how many contractions she is having? How many contractions she is having at around 1 p.m.?
Yeah,
4 contractions.
4
Heavy
contractions.
4 contractions.
Give me the detailed information. 4 contractions in 10 minutes, lasting for
45, more than 45.
More than 40 seconds.
Okay, more than 40, because you have seen it is filled proper. It is completely filled proper. Okay. So what anybody can tell me, what is the status of uterine contractions at 10 a.m.?
10 a.m. पे मैम 3 contraction.
Very good. Very good.
Between 20 to more than 20 seconds के लिए.
Okay. So there is a range 20 to 40 seconds. Okay.
हाँ, 20 to 40 range.
लेकिन आपने ये बिल्कुल सही बताया कि उसके contraction 20 सेकंड से ज्यादा है, और अगर 20 से कम होते तो आप कैसे प्लॉट करते?
मैम डॉटेड.
ओके, डॉटेड. और ये स्क्वायर जो है ना क्या बताएगा आपको? नंबर. अगर एक स्क्वायर फील्ड है तो सिंगल कंट्रैक्शन, 2 है तो 2. तो यू हैव राइटली पॉइंटेड आउट कि उसके 3 कंट्रैक्शंस आ रहे हैं, एंड दैट इज लास्टिंग फॉर that is between 20 to 40 seconds. ठीक है. सो इसमें क्या होगा? पेशेंट नॉर्मल डिलीवर करेगी नहीं करेगी?
यस मैम, नॉर्मल
कर जाएगी.
नॉर्मल करेगी. व्हाट इज द स्टेटस ऑफ फीटल हार्ट एट 1 PM? फीटल हार्ट कितना है? 1 PM पे फीटल हार्ट कितना है?
मैम
140.
मैम 140.
140. It is normal fetal heart?
Yes ma'am.
It is normal. It is no fetal bradycardia, no tachycardia. आप ही ने तो बताया 120 to 160 है. So
Yes,
it is normal. What is the status of the membrane?
मैम मेम्ब्रेन रप्चर हो चुकी है लेकिन लाइकर क्लियर है.
Very good. So again it is going towards normal. लाइकर क्लियर है, membranes रप्चर हो गई. What is the status of molding? कोई molding नहीं है, and they have not written molding also. अगर कुछ भी है आपको लिखना है, इस पे खाली नहीं छोड़ना है. So molding should be there. Uterine contraction इसमें अभी डिसेंड का नहीं है क्योंकि डायलिटेशन ही के बारे में बताया था, और डायलिटेशन हमने क्रॉस से किया है. अलर्ट लाइन के लेफ्ट पे ग्राफ है हमारा. कोई भी ग्राफ अलर्ट लाइन के राइट में आता है या एक्टिव लाइन को क्रॉस करता है तो आपका अलार्म अलर्ट लाइन के राइट में जैसे ग्राफ आया तो दैट इज एन अलर्ट फॉर यू. You have to reevaluate what is the cause of this. Either the patient is going into prolonged labor or obstructed labor, or so that is why if required अगर condition ठीक नहीं है तो you have to refer. So that is all for today regarding partograph. So this patient delivered vaginally, normally, with good contraction. This is a partograph of a normal progress of labor. Maternal vitals normal hai, fetal condition theek hai, normal progress. So okay, thank you so much. This finishes your partograph part.